This will be a very important course for our membership. Leaders and experts in particular fields within thoracic aortic disease will be there to share both their experiences, but also their vision and their perspective of where this field will take us in the next 5 years.
The TEVAR course is going to be very exciting. In TEVAR, there is a lot going on, and there is an amazing transformation happening, especially regarding the role of the cardiac surgeon or cardiovascular surgeon in TEVAR.
The format of this symposium will be heavily case-based and extremely interactive. The goal of this symposium is not only to get the educational content out, but also engage our membership to talk about particular scenarios, particular clinical cases, and it's meant to be a very interactive dialogue between both the faculty and the attendees. And in fact, the attendees are encouraged to bring case representations or perhaps case scenarios that they would like advice on and how to treat these patients.
Approximately 18 months ago or so, the US FDA, the FDA, brought out or proclaimed a broad indication for the use of TEVAR in type B aortic dissection of all types. Now the data was only in acute complicated type B dissections. So therefore it's up to us, meaning the community of TEVAR surgeons as well as the cardiothoracic surgeons of the world, to come up with indications and data and consensus statements, etc., regarding the use of TEVAR in chronic type B dissections, in residual type A dissections distally, in acute uncomplicated type B dissection, and acute uncomplicated type B dissection that may have risk factors or features for late aortic events. The next big push for the use of endografts in thoracic aortic disease is going to be proximal. It's interesting to note that the companies, the industry, most of their R&D, most of their research and development budgets at this time in history are devoted towards a thoracoabdominal aorta, thoracoabdominal aneurysm repairs using endovascular approaches, and proximal aorta. In other words, the ascending aorta in a type A dissection paradigm, and the aortic arch. The aortic arch is a primary TEVAR component, as well as branched arch grafts, as well as a arch completion operation, endograft completion operation, after primary index type A dissection repair by the cardiac surgeon in an open fashion. So there's a lot going on. All the money, all the resources are going into this area. It is incredibly important for cardiovascular surgeons to be involved. This is our time for endograft revolution in the thoracic aorta.